was irresponsible.
Not if it prevents a fatal coronary.
You're a doctor, not God Almighty.
Yes, I am a doctor. And that woman is my patient. I believe she's suffering from a destructive marriage, and I feel it's my duty to tell her.
And if you're wrong?
I'm not. Steve, when I'm wrong, I admit it. As a matter of fact, I admit error with some reluctance and hostility. And as a matter of fact, I was wrong recently. I apologize.
Do tell.
About the Gonzalez family, I checked Frank's history. There have been signs of increased tension over the past year. Some very high blood pressure readings, a mild attack of dizziness. Add it all up and you were right.
Of course, as always.
All right, well, I called his office and I left a message for him to come in for a checkup.
Good. What tests are you planning on? Oh, tell me over a cup of coffee. Come on, I'll buy.
I'd love a cup of coffee. I'll buy.
Look, you know how I feel.
I'm not so sure.
I love you, Evelina.
It's not a sin. You can say it out loud.
Hey, Chica, I'll see you later, huh?
I'll be waiting, Chico. Frank, what did Dr. Oliver call about?
Well, I don't know. It's on the tape. Big deal. I gotta come in for an eye exam in 3 months. It's a regular thing, you know. Well, maybe she's, after me, huh? Hey, I left the Harrison specs at the, house. I gotta talk to him. Could you get him for me?
Honeymoon's over, I guess.
Hello? This is Mr. Gonzalez. Is Dr. Oliver in? Well, that's okay. Just give her this message. Tell her I can't come in for any examination. Not now. I'm too busy. I'll call her when I can make it. Yeah, tell her that. Tell her I'll call her.
Hey, if it isn't late, Dr. Oliver.
That wasn't funny the first time, Bailey.
But it's not the first time.
I'm sorry, everybody. I got a disturbing message from one of my patients. Excuse me, Lou. I'm sorry.
All right, let's get back to the West.
The husband can't talk to his wife, and she won't listen to you. Would you say she's a highly religious woman?
I don't know.
Why don't you find out? Maybe you could work through her ministry. Very often, one kind of faith will lead to another.
I'll try that. Thanks.
All right, who's next?
Dr. Kiley sat in with me today on Mrs. Walters, my chronic coronary insufficiency.
Janet made a recommendation.
Yes, I told her she could solve her medical problem by dropping Mr. Walters out of a window on his head.
Janet, I've gone over the Walters file, including the time they were separated.
During which time Mrs. Walters improved sharply.
Temporarily, yes, until February of last year, at which time she suffered an infarction.
Right around the time they got back together.
No, she was hospitalized, and that caused them to get back together. You goofed that part of her history because you'd already made a decision. Unfortunately, the facts contradicted. Mrs. Walters' marriage creates a lot of tension, but its breakup hospitalized her. She has a problem. She finds it hard to live with her husband, but she loves him. She might not survive a divorce. She has to learn to live with him.
That is your very sentimental conclusion.
How else can you interpret these facts?
Through personal knowledge. Through watching that woman commit slow suicide.
That's personal prejudice, not knowledge. Janet, you just can't order somebody to change their lifestyle and pretend it's medical advice. And you certainly can't do it with the authority of the Family Practice Center. I'm sorry, but I'm making that an administrative order.
Why? Either we're doctors Doctor. It makes me vomit.
Since 1972, Meineke has helped